What if I told you your child's ADHD symptoms, so their struggles with focus, impulsivity, emotional outbursts, might not actually be ADHD at all? And what if the real culprit was something that no one ever told you to check for? A past head injury, even one that seemed minor at the time. Bumps, falls, sports accidents, they add up. But the scariest part, these hidden brain injuries can keep affecting your child for years without anyone even realizing. So today we're uncovering the shocking connection between concussions, brain injuries, and ADHD symptoms, and most importantly, what parents can do about it. Welcome to the Soaring Child podcast, where parents of children with ADHD learn tips and tricks to help their child soar at home, at school, and in life. We feature interviews with experts, medical professionals, and parents just like you who are learning how to reduce ADHD symptoms using food and other natural strategies. Because children with ADHD deserve to soar just like every other child. I'm Dana Kay, your host. Hello parents, welcome back to another edition of the Soaring Child podcast. If you've ever felt like traditional ADHD treatments aren't giving you the full picture, you're not alone. Now, many parents spend years searching for answers, trying different medications, therapies, and school accommodations without ever being told to look deeper into the brain itself. And today we're diving into a piece of the ADHD puzzle that rarely gets talked about, one that could be, the missing link in your child's challenges, brain injuries. And I'm joined by Nate Pope, who is a neurological occupational therapist and co-founder of NCX Brain Recovery. He has spent over 20 years pioneering breakthrough therapies for children with concussions, traumatic brain injuries, and neurological struggles. And Nate is here to shine a light on a topic that I think most parents never even think to consider: how those past bumps, falls, and even minor head injuries can really quietly impact focus, emotional regulation, and behavior for years to come. Nate, I am so excited to welcome you to the show today.
Thanks for having me.
Really excited to dive into this topic. A lot of kids with ADHD, they've had their falls, their bumps, even concussions from sports, but most parents, never connect those to focus and behavior struggles. So how can they tell if a past head injury is still affecting their child's brain?
Um, yeah, so that's a great question. There's so many symptoms that are connected to the brain. Um, if we're talking focus in particular, you may notice that learning is more difficult in school, and it happened within weeks to months, maybe even a year after a concussion or a head injury. If that's the case, that more sudden onset where you were able to learn, you were able to engage in focus, and now it just is harder. Reading is harder. Focusing, retaining what you're learning is harder. You may have some memory and focus issues. Um, those kinds of learning challenges that kids go through, sometimes, they'll get diagnosed with ADHD, or they can get a classification in school as a learning disability, and they didn't really see it coming. The parents are surprised that they thought they were doing well and now they're not. If that's ever the case, and there's other symptoms too, you could have headaches and balance or dizziness or lightheadedness. There's so many other symptoms. Socially, you might not be as connected. You could have anxiety, depression, irritability. There's so many of those symptoms. If you see even a little bit of many of those, that's a pretty good sign that you may have what's called post-concussion syndrome. And part of post-concussion syndrome can look a lot like ADHD. And so a lot of times that's where the confusion can be.
Interesting. I want to just sort of dive deeper into something that you said there. And look, a lot of the kids, especially the ones that I work with, they may get diagnosed in, say, kindergarten. The parents sort of didn't think that anything was abnormal at home because there was no pressure of that learning environment. And so, how does a parent decipher between, oh, just starting a new environment in school to possibly 4 to 8 weeks after having a concussion? How can they really work out whether it is that school environment and it's real ADHD, or it has, stemmed from a concussion or an accident?
Yeah, sure. Well, you can have some discussions with your children. You have to ask the right questions
Hmm.
and kind of dig a little deeper because kids they don't know what's going on and they're not going to advocate for themselves usually. They're not going to give you the details that might help you figure some of that out. But it's good to be in touch with their teachers. And if a teacher notices, if there's any academic drop or things that a teacher notices, like yeah, they have a hard time focusing. They're staring off into space or they're trying to avoid work. Some avoidance strategies. They might do anything to get out of reading, for example, where maybe they used to like to read and now they don't anymore. That's something you can notice
What
too.
happens if it's in a kid younger than the school age?
If it's younger than a school age, it's even more difficult, of
Yeah, I can
course.
imagine.
Yeah. Um, you know, Parents sometimes just get a feeling like something's off, and they don't always know what, and it's okay. Um, Even, really good parents. I have many kids of my own, and uh, sometimes I don't know what's going on with them. And I'm a therapist and a
Yeah.
parent and I've done this, but I'm like, I don't know. But
Mm.
something's off. And if you feel like something's off, sometimes if you know they've hit their head, then that should be at least a little bit of a warning sign to you to say,
Mm.
oh, I wonder if it's connected because 80%, between 75 and 80% of concussions reset and are totally fine with no lingering symptoms. But that 25 to 20% is still a pretty big number if you think about it. So
Yeah.
um, you could hit your head once or twice or three times. If you're two or three times, your percentages just go up. And so there's a lot of kids walking around out there that the parents don't know and the kids don't
Mm.
know, but they've got some symptoms they didn't have before, and life is just a little bit harder, and the quality of everything kind of drops when your brain's not quite working right. And parents will
Yeah.
get a sense of like something's off, they're just not happy, or something's different. And if you can just think back, did they hit their head? That's probably the
Mm.
best because
Mm.
the chronology of hitting your head and then having some things that you can't really explain after is probably the best, easiest warning sign to say, I should go maybe get this checked out. We
Yeah.
do free consultations and stuff I can talk about later, but it's nice to have somewhere to go, a professional that can give you some insight as to what might be going on.
Definitely. And look, I think a lot of parents out there and a lot of listeners, I know, look, I've got two boys. We were discussing it earlier. And they're boys. They love to bounce around. They fall over. And I would never make the connection between falling over off their bike or, you sometimes you don't even know if they've hit their head. And so just hearing this conversation can be that sign like, oh, maybe I need to look a little bit deeper. So you mentioned the term post-concussion syndrome. What does that actually mean? How can it show up in kids, and why is it so often mistaken for ADHD?
Sure. Um, well, as you mentioned, kids are rough and tumble a lot of times, and that they're hitting their head all the time,
Mm,
and most of those are really inconsequential and aren't that big a
okay.
deal. You shouldn't
Yeah.
be overly stressed, you know. But if they get a pretty hard hit,
Yeah.
it takes a pretty good hit. But if they get hit pretty hard, which also happens, unfortunately, pretty frequently, um, it can jar the brain. A concussion is essentially an acceleration, deceleration injury where the brain isn't designed to go from one speed, going pretty fast and then stops. And there can be some stretching of the neurons. It's not really the part of the where it hits the skull in the head. It's actually the whole brain kind of stretches because some of the brain is more flexible than other parts, some's less or more dense. And so when it stops really quick or gets hit hard, um, there's some stretching of the neurons. And then some of the areas of the brain disengage and don't get as much blood, and other areas recognize they're not as active, so they take over and get more blood. It's awesome that our brain can compensate.
Mm-hmm.
The problem is the areas that take over for the areas that have gone less active are not designed to do that long term, and they're usually not nearly as good at it. And that's why you have symptoms with a concussion. In 2 or 3 days to 2 or 3 weeks, most concussions just reset and those symptoms go away. So that imbalance of, parts of the brain overworking for other parts that have kind of been knocked offline a little bit, that
Mm-hmm.
usually just resets in that 2 to 3 weeks. When it's three, and when you get to especially 4 weeks or more, and you still have symptoms, at that point, the brain usually has decided this is the new norm and it's stuck in a compensation pattern, essentially, where some areas are just disengaged and not as active as they should be, and other areas are forced to take over those jobs and compensate. And that leaves you with post concussion syndrome. So anything post 1 month from when you hit your head, if you have symptoms that linger and just didn't get better, then you very likely could have post concussion syndrome. And that usually doesn't fix itself. And
Mm.
and an hour here or an hour there therapy actually doesn't fix it either. It's usually, if you do an hour of therapy, for example, the parts that are already engaged in overcompensating, they're the ones that are active and they're going to try to compensate even harder for
Okay.
an hour while you do that therapy. It's not usually enough to challenge the brain to engage the parts that are inactive. And so you need
Sounds
more
like
of
you
an,
need a more intense
yes,
frequency of that therapy. Now,
correct.
you've obviously worked in this space a while. What are some of those myths or misconceptions that you see when it comes to concussions, brain health, and ADHD?
Sure, sure. Well, the first misconception everyone should know about is when you get a concussion, don't go in a dark place and do nothing. We
Mm,
call it cocooning. It's
okay.
very much it's depriving your brain of the stimulation it needs to re-engage everything.
Yeah.
And that's what used to be, and unfortunately is still often recommended. Oh, you hit your head, go go to a dark room, don't do anything. So you go in a dark room and you're limiting your visual stimulation. If it's quiet, you're limiting your auditory. If you're not moving, you're limiting your body movement centers and balance centers, and you're essentially allowing whatever went inactive to to be more likely to stay inactive. So don't go do nothing. So
Hmm.
you have to take it easy, but you do want to get stimulation. So going for walks while you're talking, maybe in the park, being outside is a great thing. And if you can walk and talk, and then also get cardio
Hmm.
that's not bouncing. So jogging doesn't work, but like a stationary bike or swimming are your two best things. those are things that if people knew about, they would avoid coming to us. So it's not a great marketing strategy for us, but really we want to help people, and if you can catch it and not even go into post-concussion syndrome because you caught it in the first few days or several weeks, then that's the best. One misconception. So let's say you don't catch it and you end up in post-concussion syndrome. One of your most exaggerated symptoms might be attention and focus.
Mm-hmm.
And that is one where people will go to a psychologist, and depending on who you go to, they may or may not even ask you about a head injury or if you had a concussion. It may not be on their radar even. And it's not necessarily their fault. It's just, we're kind of just learning that this is what we should be more aware of. And so they may end up going down the road of you maybe have ADHD and we just didn't realize it. And it's just school's getting harder these days. And now it's, because of this or that, now it's showing up and not realizing it's because you had a head injury or a concussion. And then they end up with medication that is ineffective because the etiology, the cause of their focus issues is not ADHD.
Yeah, which
It's,
makes total sense. So,
yes,
what are some of the most sort of powerful therapies that you've seen actually help kids who are in this state, improve that focus and that behavior?
sure. Well, one of the really awesome, hopeful pieces of this is if your focus and attention issues are connected to a head injury, then that is completely fixable in most cases.
Yeah.
And the treatment is not that bad. It's we do 7 hours a day in the clinic, Monday through Friday, and then another Monday through Friday. Usually it's a 2 week thing, unless you have really minor symptoms, and then we may just do 1 week. But by the end, most patients have their focus back, and
Wow.
along with all of the other symptoms that they've been dealing with. And we have an 8 week aftercare program because you really want to have some lifestyle changes, some habits
Yes.
connected to hopefully hobbies and interests and things that you might already choose or want to do, but also happen to be very brain healthy. Um, and so in the clinic, we try to engage the brain where the brain has to process multiple processing areas simultaneously. So you are going to be moving your body, balancing, thinking about what you're doing with your body, motor planning and balance and stuff, at the same time that you're talking and engaged in conversation, maybe a word retrieval game or something like that.
So
Um,
that's
t-
what the therapy looks like, is it?
yes,
Yeah.
yes.
Mm-hmm.
Yeah, and you'd be doing that at the same time that we might be throwing a ball where you're visually having to track.
Yes.
And it's a very visual motor, auditory verbal, and vestibular proprioceptive, which are the centers that work with your balance and body movement. And so the brain has a really hard time being imbalanced when you make it process multiple things simultaneously. Those areas of your brain have to now integrate. Your neural pathways have to be a lot more robust and connected with each other. And you can't have one area just compensating for another as easily. So you kind of break those compensation patterns. And if your focus issues are related to that, then that's one of the best ways to re-engage the areas that are inactive, and the focus just naturally gets better after that.
So I'm curious, you mentioned that you can turn this around within 2 weeks, which is phenomenal. And I think, for families out there where this could be an issue for them, how do you assess whether or not a child has ADHD or they've got post-concussion syndrome? So if they come into your office and go, my child hit their head, how do you really know if it's this or that?
Sure. No, it's a great question. So the chronology gives you the first hint. I hit my head and then it
Hmm.
came.
Yeah.
That's a first big hint, that it might be, right?
Yeah.
Because most ADHD don't have quite such an abrupt beginning, if
Hmm.
that makes sense.
Yes.
And so that's a big first hint. But then after that, we have there's a list of 40 symptoms. It's a symptoms checklist that we run through. Each symptom is put on a severity scale from 0 to 6, and we rank the severity of each one of those 40 symptoms. And they're all typical symptoms that you would often have if you have post-concussion syndrome. Rarely does someone just go through that list and the only thing on there is a attention focus.
Yes.
And
Yes.
so what happens is we go through and that's the first one that they mention because it's maybe the most prevalent. But then they'll say, "Oh, well, yeah, actually I do have word retrieval." When I explain what that is, like, yeah, it's harder for me to find the words when I'm talking. I'm like, okay, what about light sensitivity or noise sensitivity? Oh, yeah, actually, I do have. And we start, okay, give me a number from 0 to 6. And like, that's probably a 2 or 3, actually. And we go down this whole list. And by the time we're done, almost every time, we'll have ADHD or not ADHD, but focus issues is
Mhm.
like maybe a 4 or 5 or 6. But then we have quite a few others, 3s and 4s and 2s in other symptoms, and all of them came after hitting their head. And
Mhm.
again, the chronology comes to play, and you say, okay, you hit your head, and not only is focus harder, but these other symptoms, which you also did not have, are also now
Mhm.
in your life. And so that's how we give our best guess.
Yes.
It's still not total scientific. There
Mhm.
is, so the clinic that I started with, that is just amazing at the research side of things, especially, um, they have what's called a functional MRI. And that's
Mhm.
what drove this therapy in the beginning. A regular MRI for a child with post concussion syndrome looks normal. They'll just say, "Oh, yeah, you're fine." And they say, "No, I've got all these symptoms. I'm not fine." A functional MRI is more like a video of the brain
Mhm.
while it's engaged in activity rather than a snapshot of the brain while it's doing nothing. And so a functional MRI can give you a lot more information.
Yes.
There's very few places that have integrated their functional MRIs with valuable assessment tools. So
Mhm.
you can't just get any functional MRI either. It needs
Okay.
to be there needs to be a battery of standardized assessments, and they need to know exactly, because they've seen so many brains that are normal. They need to know what abnormal also looks like, and in every area of the brain, how much blood should it have during this activity versus this activity, and then they see, oh, your blood, you don't have nearly as much blood as you should have in your area of word retrieval. And when we're trying to do that task, another area is lighting up with extra. That's probably compensating. And that's kind of how they figured out what was going on in the brain.
Okay.
Um, Most patients don't need to get a functional MRI, they're pretty expensive. And
Mhm.
they usually are validating of the symptoms. And
Yeah.
so if you have a pretty good symptoms checklist, it's a pretty good indicator you have
Okay.
that
Makes
going on.
sense.
Yeah.
Makes sense. Okay, so Nate, I ask every guest this. I know that we've touched on a couple of different topics throughout this episode, but if you could just share one small actionable tip that parents can start using today, what would it be?
Oh gosh, so many to choose from. Um, you know, I really like families are a great vehicle for helping kids change, doing stuff with your kids. I mean, it sounds a little bit obvious, but
No, I
it's still worth repeating and emphasizing, because if you do stuff together, um, you have to think about. the social interactions,
Mm.
listening and talking, but you're playing a game, and most games have a great cognitive challenge as
Mm.
part of the game. Um, and if you can do a lot of movement games, activities with your kids, being outdoors, those kinds of things are the most actionable, things, and a family is a great vehicle for that. But if you need to get them involved in extracurricular things, of course, that would be another great thing to do as
Awesome.
well. Yeah.
Yeah, no, I love that because again, it is this multifaceted approach that we take to help our children thrive, and the family unit, when you can repair bonds and you can build that family bond, that is also giving an amazing base to help your child thrive. Nate, thanks so much for
Sure.
sharing your knowledge today. It's incredible to think about how many kids could be actually struggling with lingering brain issues without even realizing it. And more importantly, it's empowering to know there are real effective steps that we can take to help them. Please tell listeners where they can find and follow you online.
Oh, sure. So it's NCX Brain Recovery .com. And if you go there, you can just go to our website. Really, free consultation is probably your best thing to do because it's free
Yeah.
and there's no obligation, and it's a lot of pretty good advice. And we have so many that we never see again, but I'm happy to help people that way, and often I think they go away with some useful tips that are kind of catered to their specific issues. And we try to give even some pretty individualized advice for people who aren't coming. And then of course there's those that are like, oh my goodness, this probably is post-concussion because we did hit our head, and they come to the clinic, and we see awesome results. 95% of our patients have almost full recoveries within the 2 weeks,
That's
because the
amazing.
brain is totally healthy brain tissue. It's just in a bad cycle. And
Yeah.
and so we figured out how to help that. So we'd love to have anyone come if
Fabulous.
they're struggling. So
Well, Nate, thank you so much again for joining us. Parents, if this episode resonated with you, please share it with another parent, especially if they have a child who plays sports or struggles with focus and behavior. The more we can spread awareness about brain health, the more kids that we can help thrive. And don't forget to subscribe to the podcast so you never miss amazing experts like Nate here. Listeners, thank you for tuning into this week's episode of The Soaring Child. I'm Dana Kate, your ADHD health practitioner. Keep on thriving. Thank you for listening to the Soaring Child podcast today. To learn more about how to help your child with ADHD soar using natural strategies, visit our website at adhdthriveinstitute.com and follow us on social media at ADHD Thrive Institute.